think that the key things to sort of emphasize from, at this venue is how important and devastating TB is for people living with HIV. It's the #1 infectious disease killer amongst people with HIV, and in fact globally it's the #1 infectious disease killer. And it's a cause of profound suffering for people with HIV and more generally. And so this report, which is entitled The Lancet Commission on TB, Building a TB-Free World, reflects the perspectives and inputs from global leaders as to what are the important investment priorities if we're going to drive down TB incidence towards a TB-free world. The report sort of makes 4 key messages. #1, we should be implementing evidence-proven strategies that we know work. So that involves delivering patient-centered care, scaling up access to prevention interventions, making universal access to drug susceptibility testing and second-line drugs universally available. #2, we need new tools, and that means investing in the relevant R&D. And the report includes economic analysis demonstrating that in a high-burden country like India, the lack of new tools costs the economy $8 billion a year. #3, we need new and innovative ways of financing TB. We need to recognize that globally, high-burden countries need to, and are already funding most of their TB response, but more could be done in terms of allocating resources domestically towards TB. And donor-funded agencies have an important role, particularly in the high-burden, low-income countries. And then #4, in order to end TB, we need to create that enabling environment that will drive down incidence and mortality. And so that involves engaging stakeholders from across different sectors. It involves emphasizing the importance of global accountability and recognizing that TB survivors and their advocates are an essential constituency that we can't neglect and must sort of include in all policy-related decisions. And we have economic analysis in the report that underscores all of these different elements, as well as EPI modeling that demonstrates what are the key priorities that will be essential to ending the epidemic.